Hi, my name is Dr. Shaun Patel. I am a physician at Miami Skin and Vein in Coral Gables, Florida. Today's video is geared towards both patients and other physicians interested in this procedure. The procedure we're going to be focusing on is Kybella. Kybella happens to be the first and only FDA-approved injectable treatment for submental fullness. Submental fullness is the fat below the chin. It's also known as a double chin. It's an extremely common aesthetic concern for many of our patients in Miami, and I'm sure that holds true for the rest of the United States and the world as well. So, we're going to focus on Kybella today. And why is Kybella such an important procedure? Well, about 67% of patients in my clinic and probably most other places, because this was a study done by the American Society of Dermatologic Surgery, 67% of patients are concerned about submental fullness, and most of them don't know that there's anything available for submental fullness other than surgery, liposuction. And so I have some good news for those patients. Kybella is on the market. It's been on the market since September 2015. It was FDA approved in February of 2015, and there's a lot of science behind it. Over 20 clinical studies were performed before the FDA approved it, and 1,600 patients were treated in those initial clinical trials. It's an extremely effective treatment and one of our most popular new treatments at our clinic in Miami, Florida. So today I'm going to perform the procedure and you're going to see how easy it is. Most patients require anywhere from 2 to 6 treatments, each treatment spread 1 month apart, and during the treatments we use about 4 mLs of fluid for each treatment. That's 2 vials. This is a vial of Kybella. So Kybella comes in a box like this. All right, and it has both a lot number on the box as well as an expiration date. And inside of the box are 4 vials, and that's 8 cc's of fluid. We use 2 of these vials per patient per treatment on average, and each patient needs anywhere from 2 to 6 treatments, although in my clinic I find that the average is closer to 2 than 6. So we're going to get started with the procedure now, but before I get started, I wanted to thank this wonderful patient for volunteering to do this. Her before and after photos will be available after the complete treatment is done on our website. There are a couple of things that I do need to tell patients about. It's a very benign procedure. It's a quick procedure, 15 to 20 minutes it takes at max. Very tiny needles are used to inject the medication into the submental area, as you will watch me do. The risk factors for this procedure are mainly benign, and they are almost all related to the injection of the medication. So swelling, bruising, redness are the most common things we see with this procedure. The swelling is significant, and I do tell my patients that they can expect for 3 to 10 days a decent amount of swelling. Each day, obviously, it is going to improve. Ice after the procedure, as well as some compression, does help with the swelling and keeping it at bay. There are some minor additional risks with this procedure, one of them which is difficulty swallowing. I have never seen that complication in any of my patients. I think it's exceedingly rare, and it's not something that I'm very concerned about. And the other one is an injury to the marginal mandibular nerve, which runs along the jawline. Also extremely uncommon. None of these in the initial clinical trials, none of these side effects were left unresolved. They all resolved with time, and so it's an extremely safe procedure. Again, FDA approved, and a lot of data behind it. Very comfortable doing this procedure. We were one of the first clinics in South Florida to offer this procedure, so I do believe we have quite a bit of experience with this procedure, and I'm really comfortable saying that it's an extremely safe procedure. Alright, so I'm going to just explain a few things before we start the procedure. I've gone ahead in the interest of time and marked the patient prior to the procedure. The patient also had topical numbing medication on for about 45 minutes prior to the procedure. We wiped off the topical numbing medication. We sterilized the skin with both ChloroPrep and 70% isopropyl alcohol. Then I went ahead and marked the patient. We marked out the mandible, and this is just kind of a landmark for us to know where the marginal mandibular nerve is. And I also marked out the submental fullness, submental crease, and the thyroid cartilage up here as well, down here as well, and both sternocleidomastoids. I then went ahead and attached a tattoo on the patient's face, a temporary tattoo obviously. These are 1 centimeter, these dots, each of these dots are 1 centimeter apart, and they just help ease my injection points, help me identify my injection points. This is provided with the medication by the company Allergan, who makes Kybella. So now we're going to get started with the procedure. I have pre-drawn the Kybella. Actually, my assistant Stephanie, my wonderful assistant Stephanie, and our patient coordinator here has drawn the Kybella for me. And I've marked out, as I already mentioned, the injection points, so we're just going to get started. This is a 30 gauge needle, a cc of Kybella in each of these syringes, and we're going to do 0.2 cc injections in each of these dots. The nice thing about Kybella is that it allows me to customize the treatment, something that I find hard in some of the alternative non-injectable procedures like the cool sculpting procedure. Very difficult to customize that treatment. This procedure is something that I can do on almost every patient with submental fullness. So we're going to get started with the procedure right now. I usually start in the middle, just a comfort zone for me. I lift the skin up and I'm doing 0.2 in each area. It's very important to get into the pre-platysmal fat. Too superficial, not very good. And it's as easy as that. Again, I'm putting 0.2 into each injection point. And this, important for the physicians that are watching the video, this is the pre-platysmal fat, not the post-platysmal fat. So just finishing up these dots here, the dots that I had set out to do at the beginning of the procedure. And then I usually have a little bit left because they do put more than 2 cc's into each vial, and I usually just target a few areas, usually where the bulk of the fat is, and this is kind of the customization of the treatment, why I love Kybella so much. So that's it. It's as easy as that. That's Kybella. Kybella for submental fullness or the double chin is the first and only FDA-approved injectable treatment for submental fullness, and we are happy to offer it here in Coral Gables, Florida at Miami Skin and Vein. If you'd like to learn a little bit more about this procedure, you're more than welcome to read about it on our website, www.miamiskinandvein.com. Visit us on our social media channels, Facebook, Twitter, Instagram, or YouTube. Or just call Zoraida from our front office team at 786-618-5039 to schedule a complimentary consultation with myself. I'd be more than happy to talk to you about the procedure and to educate you on its benefits. Look forward to meeting you.